This video is sponsored by Tanabe Pharma America Inc., TPA. The speaker is presenting on behalf of and has received compensation from TPA. The content in this video is not a substitute for independent clinical assessment or judgment.
Hello, my name is Dr. Jeffrey Rosenfeld, and I'm a neurologist with a specialty focus in neuromuscular disease. And I've had the great opportunity over almost my entire career of taking care of patients with ALS. And there are many developments in ALS. This is a very exciting time in both understanding the mechanisms and the management of the disease. The purpose of today is not for me to provide any medical advice to you. Your doctor is the best source of information about your disease. ALS is a neurodegenerative disease that affects motor neurons. That means motor nerve cells that live both in the brain and in the spine degenerate over the course of the disease. Now, motor nerve cells that live in the brain, we call those upper motor neurons. And they send a signal down to the spine, which we call lower motor neurons. And the specific symptoms that you might have as a result of the ALS are completely dependent upon which motor nerve cells in the brain or in the spine are affected. And that's very variable. In ALS, these motor neurons degenerate or deteriorate, and they can disrupt these signals either from the spine or from the brain. In ALS, no two people are alike. That's probably very apparent to you already. ALS symptoms vary significantly from one person to the other, and that's based upon which motor nerve cells are affected. ALS can affect you in many ways. For some patients, it's mostly speech, swallowing, and sometimes breathing. For other patients, it's use of your hands, your arms, your dexterity. And yet for other patients, perhaps it's difficulty with your lower extremities, difficulty ambulating, getting up from a chair, walking, and so on. ALS can progress rapidly for some patients, and yet in other patients very slowly. And unfortunately, we really don't understand why there's that variability. When ALS does progress, a person can gradually lose physical strength, become weaker, which certainly can limit movement and the ability to have an independent lifestyle. If you know other patients with ALS, it's very probable that they're experiencing some symptoms that are different from those that you're experiencing. That's why it's very important for you and your doctor to identify the symptoms that are occurring for you, track how fast they're progressing, and try to intervene as early as possible. Managing ALS is a team approach. As we say, it often takes a village because the number and the diversity of the problems is so varied. Patients with ALS have a variety of medical needs that really depend upon their individual symptoms. The multidisciplinary team of professionals who treat patients with ALS on a regular basis can best provide you with a care plan that's tailored to your needs, to your aims, to keep you as mobile, as comfortable, as independent as possible. For example, a speech pathologist can help you if you're having any difficulty speaking or swallowing. An occupational therapist can help you with adaptations or changes to how you perform your daily activities. A physical therapist can help you with your ambulation. There are many, many resources available and hopefully within reach, so that you must know that you don't have to go through this ALS journey alone. Talk to your doctor as soon as you can to determine how you can best manage your ALS.